Before receiving Docetaxel, it's important to read the Patient Information Leaflet from your pharmacist. This medication is given by injection into a vein by a healthcare professional, usually over 1 hour every 3 weeks. The dosage and frequency will be determined by your doctor based on your medical condition, body size, and response to treatment. Your doctor may also prescribe pre-medications, such as corticosteroids, to prevent side effects like swelling and allergic reactions. These pre-medications are typically started 1 day before treatment and continued for a total of 3 days. It's important to follow your doctor's instructions carefully. If you forget to take your pre-medication, or do not take it on schedule, be sure to inform your doctor or nurse before receiving your Docetaxel treatment. Side effects of Docetaxel vial may include pain or swelling at the injection site, nausea, vomiting, diarrhea, excessive tearing, fatigue, dizziness, drowsiness, feeling drunk, constipation, and loss of appetite. Your doctor may prescribe medication to help with nausea and vomiting. It's helpful to eat several small meals and limit activity to lessen some of these effects. Temporary hair loss and nail changes may occur, but should return to normal after treatment. Serious side effects may occur, so it's important to tell your doctor if you experience unusual tiredness, swelling, numbness, muscle or joint pain, or other symptoms. This medication can also decrease your body's ability to fight infection, so contact your doctor if you develop any signs of an infection. Docetaxel may rarely increase the risk of other cancers, so your doctor will monitor you closely during and after treatment. It may also cause side effects due to the rapid destruction of cancer cells, and your doctor may recommend additional medication and fluids to lower the risk. Seek medical help if you experience chest pain, vision changes, or signs of a serious allergic reaction. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you experience any side effects, be sure to contact your doctor for medical advice. Before using Docetaxel, it's important to let your doctor know if you have any allergies or if you have a history of liver, lung, or heart problems. This medication may cause dizziness or drowsiness, and it contains alcohol, so it's important to use caution if you have liver disease or need to avoid alcohol for any reason. Additionally, be aware that using marijuana can increase these symptoms. It's important to avoid activities that require alertness for 1 to 2 hours after receiving this medication. Docetaxel may increase your risk of getting infections, so it's important to stay away from anyone who is sick. This medication may also affect your body's response to vaccines, so be sure to inform your healthcare professional before receiving any immunizations. If you are pregnant or plan to become pregnant, it's important to talk to your doctor about the risks and benefits of using Docetaxel. This medication may harm an unborn baby, so reliable forms of birth control should be used during treatment and for some time after the last dose. If you or your partner becomes pregnant while using this medication, it's important to speak with your doctor right away. Breastfeeding is not recommended while using this medication, as it is not known if the drug passes into breast milk. Be sure to consult your doctor before breastfeeding while using Docetaxel. It's important to be aware of any potential drug interactions that could affect how Docetaxel vial works in your body. Certain medications and herbal products may have a negative interaction with Docetaxel, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Some products that may interact with Docetaxel include medications that could have a bad reaction with alcohol, as well as other medications that can affect the removal of Docetaxel from your body. It's important to inform your doctor or pharmacist if you are taking any products that cause drowsiness, as they may interact with Docetaxel and affect its effectiveness. Additionally, it's important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any concerns about potential drug interactions with Docetaxel, be sure to ask your pharmacist about using those products safely. If someone has overdosed on Docetaxel vial and has serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is crucial to act quickly in the event of an overdose. It is important to have regular lab and medical tests, such as blood cell counts and liver function tests, while using Docetaxel Vial. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Docetaxel Vial as prescribed by your healthcare provider. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action for rescheduling your next dose. This medication, Docetaxel Vial, is given in a clinic setting and is not meant to be stored at home. It is used to treat various types of cancer, including breast, lung, prostate, and stomach cancers. The dosage and timing of administration will be determined by your healthcare provider based on your specific condition. Be sure to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.